Hello, my name is Jose Tirado, and today I'm doing my head-to-toe assessment on my daughter, Natalia Tirado. Prior to entering the room, we had Natalia empty out her bladder, we obtained a set of vital signs, we did her height and weight, and we assessed her far and near vision test using the Snellen and Rosenbaum chart, which was 20/20 equal bilaterally, and it assesses cranial nerve number 2. Prior to touching the patient, I washed my hands. First thing we want to do is we want to take an overall look at her appearance, at her head, at her eyes, her ears, making sure that it's normal cephalic. The first thing we want to do is we want to palpate her skull. When we palpate her skull, we want to make sure that we don't feel any masses, lesions, or any step-offs, which we don't. Do you feel any pain?
No.
Then we want to also test the texture of her hair, whether it's fine or coarse, and the distribution of her hair, making sure that it's even and there's no alopecia noted, which there isn't. Then we want to palpate her facial bones. Okay, look here. And noting if there's any tenderness or pain. Any pain?
No.
Okay. Then we want to palpate the frontal sinuses and the maxillary sinuses. Again, noting if there's any tenderness or pain. Any pain?
No.
Okay. Then we want to palpate her temporal mandibular joint. We're going to have her open her mouth and move side to side, noting if there's any clicking or pain. Did you have any pain?
No.
Okay, good. Next thing we want to do is we want to have her close her eyes tight. Okay, open them. Frown your forehead. Good. Clench your teeth. Smile. Frown. Stick out your tongue. Puff out your cheeks. Good. And we're assessing cranial nerves 5 and 7. Next, we're going to do the test sensation. Using a cotton tip applicator, I'm going to have her close her eyes and tell me if she feels sharp or soft. Okay, close your eyes. Tell me if you feel soft or sharp.
Soft. Soft. Sharp. Soft. Sharp. Sharp.
Good. You could open your eyes now. Next thing we want to do is we want to take a look at her eyes, making sure that her eyes, her eyelids, there's no drooping of the eyes. We want to take a look at her eyebrows and her eyebrows and eyelashes, making sure that the hair is evenly distributed. When we also want to take a look, which I see her hair, or her eyebrows and eyelids are equally distributed, the hair. Then I want to take a look at the sclera of her eyes and the conjunctiva. The sclera should be white and the conjunctiva should be pink and moist. Good. Her conjunctiva was pink and moist and her sclera was white. We also want to take a look at, we want to test the cover-uncover test. So go ahead and cover your left eye. Uncover it. Good. Now cover the other eye. Uncover it. Good. And what we're assessing here is making sure there's no eye jerking or eye movement. Next, we want to assess her pupil response using a light pen. But before we do that, I want to palpate the lacrimal apparatus, making sure there's no draining or swelling. Do you feel any draining? Do you have any swollenness?
No.
No? Okay. Next, we're going to, like I said, we're going to test her pupillary response. Open your eyes wide. Okay. Look at straight ahead. Okay. Her pupils were equal, round, reactive to light. Next, we want to check for the red reflex. Good. Next thing we want to do is we want to test her visual fields of vision using a pen light. Only with your eyes, follow my pen light. Good. I didn't see any abnormalities. Next thing we want to do is we want to check her ears, the alignment of her ears. And they're aligned perfectly. Next we want to palpate her ears, the auricle, checking for any masses, lesions, or any calcification. Any pain?
No.
No? Okay. Good. Next thing we want to do is we want to assess cranial nerves number 8. We're going to do the whisper test. I'm going to have her cover her right ear and repeat the word she hears.
Light.
Cover your other ear and repeat the word I say.
Tight.
Good. Next we're going to do the Weber-Rhine test. With the Weber-Rhine test, she should be able to hear the sound in both ears. Do you hear it in both ears? Okay. Next we're going to do the air bone conduction test. I'm going to strike the tuning fork on the palm of my hand and place the tuning fork on her mastoid bone, and I'm going to tell her to tell me when she stops hearing it.
Stop.
Now I'm going to do air conduction.
Stop.
We're going to go and do it on the other side.
Stop. Stop.
That was testing for cranial nerves number 8. Next, we want to inspect the inner ear canal. We want to check for any redness, swelling, or drainage. We also want to assess her tympanic membrane. Okay. She has a little earwax, which is perfectly normal. The tympanic membrane, I see the reflect of the light, and there's no redness, swelling, or drainage. Again, her tympanic membrane is intact. I see the reflex of the light, and there's a little earwax, but there's no redness, drainage, or swelling. Next thing we want to do is we want to take a look at her nose. We want to take a look at her septum, making sure that it's not deviated in any way. It's not. Then we're going to have her cover one nostril, take a deep breath, making sure there's no obstruction. Cover one nostril, take a deep breath. Good. Cover the other nostril, take a deep breath. Good. There is no obstruction noticed. Next, we're going to look inside her nose. When we look inside her nose, we want to look at her mucosa, we want to look at her septum, and we want to look at her turbinates. We want to make sure that there's no redness, swelling, or drainage, and there's no polyps of any sort. Okay? Go ahead and tilt your head a little bit back. Good. Good. I didn't notice any redness, swelling, or drainage. Next thing we want to do is we want to take a look at her mouth. When we take a look at her mouth, we want to take a look at the color of her lips. We want to make sure that they're pink and moist, and we want to make sure that there's no cracks or fissures on the side of her mouth, which there are none. Then we're going to have to take a look inside her mouth. When we look inside her mouth, there's a couple of things we want to assess. We want to assess her anterior, posterior pillars, her tonsils, her uvula, her oropharynx, her hard and soft palate, her gums, her teeth, the symmetry of her mouth, the movement of her mouth, and we want to test the gag reflex. So I'm going to get my pen light and assess that. Go ahead and say ah. Okay, I don't notice any masses or lesions. Her teeth are all there. Okay, stick out your tongue. Her tongue is pink and moist. Let me see the sides of your mouth. Okay, the other side. Good. Underneath your tongue. Okay. It was all within normal limits. I didn't notice any bleeding gums, all her teeth were intact, her uvula was midline, and there was no malorder of her mouth. Now I'm going to do the gag reflex. Go ahead and say ah. Positive gag reflex. She hates that. Next, what we want to do is we want to inspect the neck. We want to check the symmetry, the contour of her neck. We want to check her thyroid, making sure there's no swelling of the thyroid or it's not enlarged. We also want to check for jugular vein distension. Okay. Next, we want to palpate the trachea and the thyroid. The trachea should be midline, which it is. Now we're going to palpate the thyroid. I'm going to have her take a sip of water, and when she does that, I'm going to palpate her thyroid, noticing if it goes up and down and if it's palpable. Go ahead and take a drink of water. Okay. I did not feel any lesions, and her thyroid went up and down. Next, we're going to auscultate her thyroid and her carotids. And before we do that, we're going to palpate her carotids. Good? Good. But before I auscultate her thyroid and her carotids, I'm going to do some range of motion exercises with her neck. So nod your head up and down, side to side. Okay. Put one ear to your shoulder, now the other. Okay, good. Now with resistance, press against my hand. Good. Now against this arm. Good. Now this arm. Good. I didn't notice any abnormalities. Next, I want to palpate her lymph nodes. I'm going to do the preauricular, postauricular, her tonsils, her submental, her submandibular. Okay? Any tenderness there?
No.
No?
No.
Okay. Next, I'm going to do her anterior and posterior cervical chain and occipital. Any pain there?
No.
Her occipital. And then I'm going to do her supraclavicular, her deep clavicular, her infraclavicular, and her axilla. Lift up your arms. Her lymph nodes were non-palpable, which is normal. Then I'm going to auscultate her thyroid and her carotids. Okay, so you look forward. Okay. I didn't hear any bruits or thrills. I also want to do the shrug test. I want her to put resistance with her shoulders against my arms. Shrug your shoulders up. Okay, good. And there was no resistance. The resistance was normal, adequate for her cranial nerve number 11. Next thing I want to do is I want to take a look at her posterior thoracic chest. So go ahead and turn around. Be careful. And when I do this, I want to take a look at the symmetry of her back, the contour of her back, taking a look at her respiration rate and rhythm, making sure there's no heaving or pulsation. And I just want to notice any nevi, masses, and things of that nature. So go ahead and straighten up your back. Okay, take a deep breath. Okay, good. Then I'm going to palpate her back, noting any lesions, masses, or any fractures or any crepitus, which I did not feel. Next, we're going to do her thoracic excursion. I'm going to put my hands on the T10 and have her take a deep breath and notice the rise and fall of my hands, and they should be symmetrical. Go ahead and take a deep breath. Good. Do it again. Good. One more time. Good. My hands were symmetrical up and down. Next, I want to do tactile firmness test. Having her say 99 and checking for the sound vibration, and it should be equal bilaterally. Straighten your back up. Say 99.
99, 99, 99, 99, 99, 99.
Good. Next, we want to percuss and palpate the costovertebral angle, asking her if she feels any pain.
No. No.
Next, we want to percuss her lung fields, paying particular attention to the sound her lungs make. It should be resonant. If we hear any dullness, it's usually a sign of fluid or some type of infection. And we're going to do this in a systematic manner. And we're also going to do her lateral sides. Good. We're also going to check for her diaphragmatic excursion. I'm going to go ahead and mark her back. Go ahead and straighten up. And what I'm going to do is I'm going to have her take a deep breath, let it up, take a deep breath, and hold it. Okay? Take a deep breath and hold it. Now I'm going to percuss my way down until I hear dullness, which is there. Go ahead and let it out. Take another deep breath and hold it. This time I'm going to work my way down, down, up, which is there. Okay. I'm going to measure it. And it should be between 3 and 5 centimeters. And it's 5 centimeters. Perfect. Go ahead and straighten out your back a little bit. I'm going to do it on this side as well. Straighten out your back. Take a deep breath, let it out and hold it. Which is there. You can let it out now. Okay, take another deep breath and hold it. Which is there. Again, I'm going to go ahead and measure it. And it's 5 centimeters as well. Next, we want to auscultate her lung sounds. When we also auscultate her lung sounds, we shouldn't hear any crackles, rails, or wheezing. And I'm going to also do her lateral sides. Go ahead and take a deep breath. Again. Okay. Take a deep breath. Okay. Take a deep breath. Okay. Now I'm going to do her posterior. Take a deep breath. Take a deep breath. Again. 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 And again. Okay. Her lung sounds were cleared to auscultation. Next, we're going to have her face the camera again. Face the camera. Be careful. Same thing as we did in the back. We want to do a general assessment, inspection of her anterior chest wall, taking note of the rate of her respiration rate and rhythm, if it's labored or unlabored, if there's any pulsations or heaving, okay? Which I don't see any. Next, we're going to palpate her interior chest wall, noting for any masses, lesions, or crepitus. Then we're going to palpate the precordium, again noting any pulsation, threes, or heaves. Then we're going to assess her apical pulse, which is midclavicular, fifth intercostal rib. I noted the rate and rhythm, which was normal. Next, we're going to percuss again her interior chest wall, noting the sound of her lung sounds. Which were normal. Next, we want to auscultate her breath sounds as well. Okay, take a deep breath. Take a deep breath. Take a deep breath. Again. 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 Now we're going to auscultate her lateral chest wall. Take a deep breath. Take a deep breath. Okay, good. Take a deep breath. Good. Take a deep breath. Good. Next, we want to auscultate her heart sounds. We want to make sure we don't hear any murmurs, and that we hear S1 and S2. First, we're going to start with the aortic, the pulmonic, Erb's point, the tricuspid, and the mitral valve. Aortic first. Pulmonic, Erb's point, tricuspid, and then the mitral. And I didn't hear any murmurs or thrills. Next thing we want to do is we want to assess her upper extremities. Taking a look at the muscle tone of her shoulders, her biceps, her triceps. We also want to take a look at the skin color, the warmth. You see the warmth? We want to look at her hands, making sure there's no edema. We also want to take look at the characteristic of her nail, and we want to do pupillary cap refill, which is less than 2 seconds. Again, looking at the contour of her arms, the muscle tone, she has a couple of nevi, which is perfectly normal. There's no edema noted in her hands. Her nails look healthy. The capillary refill is less than 2 seconds, which is good. Next, we want to also palpate the radial and brachial pulse, taking note of the rate and rhythm of her pulses. Good. The rate and rhythm was regular. Next, we're going to inspect her abdomen. So we're going to have her lay down. Put your arms on your side, please. On your side. I'm going to expose her abdomen. And what I want to do is, I want to take a look at the contour and symmetry of her abdomen. And I'm going to make sure that there's no pulsation going on. And I'm going to use my pen light for that. Which I don't see any. Next thing I want to do is, I want to auscultate 4 quadrants of her abdomen, noting the vowel sounds, whether they're hyperactive, hypoactive, or if they're absent. If they are absent, then we got to listen for an additional 5 minutes. Okay? Her vowel sounds were normal. Next, we want to auscultate her aorta. Her right renal artery, her iliac artery, her femoral artery, and we're checking for bruits or thrills. Renal artery, iliac artery, and femoral artery. No bruits or thrills noted. Next thing we want to do is we want to do percussion of the abdomen. We want to percuss the border of the liver and the dullness of the spleen. There's the dullness, I'll mark it. Then the dullness of the spleen, which is there. Then we're going to percuss the abdomen. And it's hyperresonance, where it should be in the bowels. Now that we've done that, we want to do a light palpation, 1 centimeter in depth. Taking note of the patient's face. If she grimaces, it might be a sign of an abnormality and possibly appendicitis. Any pain there?
No.
Pain there?
No.
Pain there?
No.
Pain there?
No.
Okay. Then we're going to do a deep palpation. When we do a deep palpation, we're going to palpate the borders of the liver, the spleen, and we're going to palpate the right and left kidneys. Palpating the liver border, soft, no nodules noted, the spleen, her right kidney, her left kidney, and we're going to palpate for the mid-aortic if there's any pulsations, which I didn't feel any. Next, I'm going to have her bend her knees, lift up her head, taking a look at her abdomen, making sure that there's no bulging, because it could signify a hernia or things of that nature. Good, and I didn't see any. Okay, go ahead and sit up. Go forward to the bed then. Next, we're going to take a look at our lower extremities. When we take a lower extremities, we're taking a look at the muscle tone, the hair distribution. We're also taking a look at feeling for temperature. And we're checking her feet for any edema. We're checking her capillary refill as well. And her feet don't look swollen. Don't look swollen. And her capillary refill was less than 2 seconds. Next, we're going to palpate the posterior tibialis, the posterior tibialis, the dorsalis pedialis, posterior tibialis, and the popliteal. Dorsalis pedialis, posterior tibialis, posterior tibialis, dorsus pedialis, and then our popliteal. Relax your leg. Good. Then we're going to test the muscle strength of our legs. Okay, push against my arms. Okay, now down against my arms. Good. Press on the gas pedal. Now this one. Now put your toes up toward my hand. Good. Good. Next we want to test her reflexes. We want to test her brachial, her knee, and her Achilles. First, the brachialis. Relax your arm. Positive. Positive. Then we're going to do the knee. Positive. Positive. Then the Achilles, which were all positive. Next, we're going to have her lay down again, and we're going to check her range of motion of her knees, and we're going to do internal and external rotation, noticing any cracking or pain. Okay, bend your knee, straighten your knee. Okay, good. Bend your knee, internal rotation, external rotation. Good. Go ahead, bend your knee. Good. Internal rotation, external rotation. There's no abnormalities noted. Next, we're going to have her stand up, and we're going to have her squat. Go ahead and squat, taking a look at her balance. Then I'm going to have her touch her toes, and I'm going to look at her cervical spine and her lumbar spine, making sure there's no curvature, any kyphosis or scoliosis, which is aligned perfectly and straight. Good job. Go ahead and take a seat. And that concludes my head to toe assessment. Thank you.